Glucometer versus medical lab GodPod method. Which is more accurate, convenient? Glucose test done in medical lab test, also known as GodPod, glucose oxidase, peroxidase method, using venous blood, considered as a reference standard for routine glucose measurement. It is highly accurate because it is done in controlled environment, on a calibrated equipment, produce minimal user error, and results are used for diagnosis of diabetes. On the other side, glucometer uses capillary blood, finger prick. Designed for daily monitoring, not diagnosis of diabetes. Accuracy is affected by strip quality and storage, temperature and humidity, poor blood drop technique, hematocrit variations, anemia, dehydration. Acceptable error range can be up to plus or minus 10 to 15% compared to lab values. Let's come to conclusion. Medical lab venous sample GodPod method is more accurate compared to glucometer finger prick method. Glucometer is less accurate but very useful for quick monitoring when patient is unwell for unknown reason, unconscious patients, in doctor's cabin, unavailability of lab test method, frequent monitoring, fear of blood loss, and patient's choice. Simple way to remember. GodPod equals gold standard lab test. Glucometer equals convenient home estimate. Important clinical point. If a glucometer shows abnormal values, always confirm with lab, GodPod or plasma glucose test. Before diagnosis, treatment initiation, modifications or treatment changes. Why fasting lab glucose and glucometer readings often differ. It's common for a fasting glucometer reading and a fasting laboratory glucose, GodPod, result to differ. A small difference is expected and doesn't necessarily mean either test is wrong. Common reasons for the difference. 1. Different blood sample site, size, equipment limitations. Laboratory test, GodPod uses venous plasma, blood drawn from a vein. It is usually large amount up to minimum 1 milliliter. Glucometer uses capillary whole blood, finger prick sample. Sample size of blood drawn is often 10 microliters, which is 100 times smaller than venous sample. Although modern glucometers report plasma equivalent values, they estimate them rather than measuring plasma directly. Accuracy limits of glucometers. Home glucometers are intended for monitoring, not diagnosing diabetes. A reading within about plus or minus 10 to 15% of the laboratory value may still be considered acceptable, depending on the device and testing conditions. Timing of the tests, even a difference of 10 to 20 minutes can change the glucose level, especially if you walked or exercised, you experienced stress or pain, you had tea, coffee, or medications. The blood samples were not taken at exactly the same time. Finger prick technique readings can be affected by not washing and drying hands properly, glucose residue on the fingers, squeezing the fingertip too hard, using too small a blood drop, test strip and meter issues, expired or improperly stored strips, dirty meter or strips, extreme heat, cold, or humidity, low battery or device calibration issues, if applicable. Laboratory advantages. Laboratories use calibrated analyzers with strict quality control, making the GodPod method more precise and reliable for diagnosis. What difference is acceptable? A difference of 5 to 15 mg/dl is often seen in practice. Larger differences may occur, especially at higher glucose levels, but repeated large discrepancies should be investigated. When should you be concerned? If your glucometer is consistently much higher or lower than the laboratory result, for example, by more than 20 to 30 mg/dl, consider checking your testing technique. Using a new box of test strips. Comparing the glucometer with a laboratory test using blood samples taken at nearly the same time. Replace. Key takeaway. Laboratory fasting glucose, GodPod, is the preferred test for diagnosing diabetes. Glucometers are excellent for day-to-day monitoring and guiding self-management, but small differences from laboratory values are normal.